Good evening. I am calling to order the meeting of the Newburyport School Committee meeting for Monday, October 5th, 2020. Mrs. Kennedy, would you please call the roll?
Mr. Callahan?
Here.
Mr. Reardon?
Here.
Mayor Holliday?
Present.
Mr. Manning?
Here.
Mr. Hofheiser?
Here.
Ms. Spalding?
Here.
And Mr. Cole?
Here.
All present.
Thank you, Mrs. Kennedy. Would you please stand to say the Pledge of Allegiance?
I pledge allegiance to the flag of the United States of America and to the republic for which it stands, one nation, under God, indivisible, with liberty and justice for all.
Thank you. Mr. Menon?
Sure. We're going to start this meeting with public comment. And our webmeister, Mr. Callahan, is going to assist us with this.
Okay, so I'm gonna select Josh Baumfeld. Josh, can you hear us?
Yep, thanks. Josh Baumfeld, 75 High Street. I was hoping that somebody could speak to how the positive test rates correlate with prevalence, particularly in a low prevalent area. How are we determining positive cases in Newburyport? I understand there's some people that might be a college that might test positive with a Newburyport address, and that can significantly change how we look at things. Also, given the issues with sensitivity and specificity of testing, and given the low prevalence in our area, what is the chance of a false positive rate for asymptomatic people that are getting tested, to go back to work? Who's analyzed the negatives of remote learning? And when does the probability of risk for long-term negative outcomes from being remote, such as suicide, depression, access to curriculum issues, when does that outweigh the risk of getting COVID and sequelae in a low prevalent area with the use of masks and other mitigation? What validated instrument are we going to use to assess students that might not be able to access the curriculum remotely when they might perfectly be able to do this in school? How are we going to assess the district and how they're educating the students in this hybrid and remote environment? Why is it safe and okay for teachers' children to attend fully in person, but some IEP students can't? And then just lastly, the superintendent laid out in his plan barriers to opening up. Much of these are related to budget space, busing, and a need for additional teachers, but we did not build the budget with those needs in mind. The budget was built before the plan. And finally, the last thing that prevents us from going back is number 8 on the list, which is, can you define what efficacious is in terms of vaccines and treatment, and what is widespread dissemination in your mind? And finally, did you have any ID experts or pulmonary experts or environmental medical professionals, medical doctors inform you on any of these things? Thank you.
Thank you, Mr. Baumfeld.
Can we turn this up? Is that possible?
Yeah. Public comment, people?
The public comment people. Does he have closed captions?
Derek Hartford.
Mr. Hartford.
Hi.
Public comment.
Yep. Derek Hartford, 22 Jackson Street. As we're getting ready to kind of add additional kids to the school, there's a few things that kind of are in my mind. And as Mr. Baumfeld seemed to have a lot more specific questions that seem like a lot of questions I'm not sure have been asked yet. Kind of support that a little bit as well. But I'd also just like to make a basic plea for some stability in these schools in the upcoming months. The spring, the at-home learning in spring, I felt went fairly well, even though it was a bit of a disaster. I also feel like the teaching staff took a lot of heat on that. And I think DESE did not do any districts any favors with the constant moving targets there. I think we need to look at that, those moving targets and these changing conditions, the lack of stability and the lack of a clear plan in the spring. Really, I think ruined a good opportunity, to make the best of what that was. That was a disaster. Stability, I think, can't be underrated. And I know Mr. Baumfeld there had just mentioned regarding the mental health of not being in school, not being with peers. But I think we have to look at that also, of the mental health of going into a school in a very unhealthy, scary times, especially probably for students who, you know, they're kind of like the rest of us. They're on edge, they're stressed out as it is, they're walking around, they're seeing people in masks. They were told the high school wasn't safe, and now it is, and we're adding more people to it. Some people are following mask procedures, others are not. Like, I'm in a school, and I see the look in the kid's eyes when someone coughs. I see the look in their eyes when I had a kid bolt out of the room the other day, and they're just looking at each other like, what do we do now? A safe learning environment is the only learning environment. It does not feel safe. And if we're trending towards a safe environment, I think that's one thing. This does not feel like a safe learning environment. Last week, just going through the minutes, and I may have, I think it was the mayor who made a mention of November and December with the holidays coming, that we should proceed with caution. If I've misquoted someone, my apologies. It was someone, I thought it was her, I didn't write it down. So, but I would just urge us to proceed with caution now. You know, holidays like Thanksgiving and Christmas, yes, people travel, but I think Halloween could be linked with them as well. The fact is, the high schoolers aren't even back yet.
Mr. Hartman, can I ask you to sum up?
Yeah, absolutely. I thought I had 2 minutes. Am I over?
Yeah.
Okay, I'll sum up. We should avoid risky behavior by having them go back even more. Putting more kids in those schools is not a stable environment. It's changing what we're asking our staff to do, what we're asking our students to do. And in the end, it's not a learning environment. It's not a safe learning environment. Or the perception is not a safe learning environment, which makes it not a learning environment. We need to go slow. We need to go cautiously.
Thank you. Thank you very much.
Thank you.
Next we have Monika Studer.
Ms. Studer, you've got a couple of minutes here for public comment.
Yes, please. Good evening. Well, I'm here again to talk about the metrics. I sent a couple of emails about it, and I just wanted to reiterate. I think we worked so hard to have the kids back in the classroom. I want to make sure our metrics actually are made in a way so we can keep them there, and are in a way that actually can enable them to have even more access to in-person learning. I outlined some questions in my email. I think some of the metrics are not specific. If you're any familiar with goal setting or something, I think the first thing you know is it should be specific and measurable. The second one is some of the metrics are not clear over which duration they are looked at. And as the governor had outlined last week, it would be wrong to take a decision in any direction just based on 1 week red or even yellow. So I think the governor clearly said it, or even Desi said it should be over 3 weeks period. So I think that should be reflected, or if not, clarified by the health experts who have put those forwards. And lastly, geography. I still don't understand why our metrics are not just tied to Newburyport. But above all, my biggest concern are really the metrics for step 3, full in-person learning. As one of the 70% of the parents who actually voted for a full in-person return to school in the survey done in July, I think the metrics that are put forward there are extremely unrealistic. They are not guided by any scientific evidence and do not reflect both prevalence and death rate for children aged K to 12. I think instead of making virtually impossible for children to return to school full-time for a very long time, I encourage you to use the current return to school experience and further adapt your models to see how we can have more children back in school. For example, I know that the biggest argument to not have them come back to school is because you couldn't guarantee the 6-foot distance. Well, I think you said that you could do 3 foot, but I was wondering if the district had rerun the numbers regarding distances with taking into account the actual enrollment figures. And as we make more experience with working with all these super extra measures that we are taking, our kids are 6-foot distance and they wearing a mask constantly. I think it should be considered if further down the road, you can bring more children back in the classroom. I also am very concerned about the fact that you require a vaccine to be widely distributed, effective. I think it will be a very long time until we have that. And if it's anything like the flu vaccine, we might never achieve that. So I think we should consider the impact of having our children so long learning in a suboptimal setting, because online learning, any form of remote, like, is just not ideal. Thank you very much.
Thank you very much.
All right, next we have Lynn Schow.
I unmute. Hi, yes, my name is Lynn Schow. I live at 75 Hyatt Street. I would like to echo all of the questions and comments of the last speaker. I thought she did a good job of setting forth a lot of the same questions that I have. Further, what I'd like to ask is that my understanding is from prior discussions in this forum is that the position of the 4 schools are quite different in terms of being able to meet the state distancing guidelines, yet they're treated as a group in terms of moving on to that 3rd step. And so I would like to see some more explanation of what metrics each of the schools actually can meet. And, you know, I would like to add that I'm disappointed that a lot of the metrics, a lot of the state guidance that Newburyport is waiting to be changed before going back in person are things that could be met with additional budget requests. Like the fact that you're telling us that we don't have the money to get enough buses to get the kids to school. So we have to wait for the state to change their distancing guidelines in order to allow kids to return to school. Just seems really crazy after we've been told that there's, you know, you can do no more. You've done everything you can do. That seems like a really, really easy fix. And then finally, I'd like to just echo what Monika said, that waiting for a vaccine that is widely disseminated or therapeutics seems like a metric that is full of ambiguity and is something that not only are you not likely to see that this year, but probably not next year in terms of you know, I've seen a lot of people have forwarded me emails where they've discussed this, that the flu vaccine that we have now is widely disseminated, perhaps not, because it's, you know, just becoming mandatory, but it's only 50% effective. And if that's the case, then we really need to consider much more robust, you know, building and busing and more teaching solutions for the district. Thank you.
Thank you very much.
Next is Simone Bui. Is that right? Sorry. Or is that wrong, rather?
Simone, if you we have a couple of minutes here for you to give public comment.
Thank you. Yes, it's Simone Bui, 44 Lime Street. I'll do this quickly. First, I want to acknowledge that in just 2.5 weeks into reopening the middle school in the hybrid model, we already have 2 infections in our school community, with a total of 28 student staff needing quarantine, not to mention the non-student family or friends who were also exposed. And I know that the second child was reportedly not infected while in school, but the fact that the contact tracing led to another 13 students who interacted with them outside of the school reflects the fact that when you begin putting kids into school together, kids naturally began getting together outside of school. That's already happening. Today is the first day of the hybrid model and its first at the high school, and its first cycle won't finish until October 16th. And yet the transition plan provides that the metrics will be looked at on October 19th and decided a week later on October 26th, whether to push more kids back into the high school on November 2nd. I think we need another 14 days before knowing whether we have any infections after October 16th. And we also need that time to understand better how the 25% model performs on issues unrelated to the metrics. Because meanwhile, the lower grades will have had the advantage of several weeks at the current hybrid model before assessing whether to transition to the next step. And yet, even from just that, we've had infections. Also concerning to me is that the transition plan cites specified surrounding towns for us to consider in the metrics, but cherry picks white, more affluent cities, notably missing is our very close neighboring city of Lawrence, a largely low-income Black and brown community that is as close or even closer than the white, more affluent Middleton or Linfield that are on the list and that are in the red. I believe that the transition criteria cannot just depend on the health metrics listed. I think it's a woefully oversimplified assessment of need, cause, and action. We need to look at the infections and exposure within our own school community, which is now emerging, and we need to slow down. Back in August, the superintendent identified and communicated to parents specific key health and safety barriers that made even a 50% hybrid unsafe and untenable. I don't need to go over what those are because we all know what those were. And the 25% hybrid was supposed to be the compromise. And I want to know what has changed that now makes the 50% hybrid safe. The metrics were low back then as well. Also, the push to bring more students to the building coincided with a significant increased movement across the state of Massachusetts as Baker begins allowing indoor venues like performance halls, laser tag venues, video game arcades to reopen at the same time. We're not asking for a risk-free learning environment. We're asking for a sustainable learning environment. We know that COVID is there. It's like a hot burning fire. We keep inching closer and closer to the burning stove, and we tell ourselves if we get too hot, we can step back. That's what your metrics say. But if it feels cool again, we can step forward. And then if it feels too hot again, we can step back. And if stepping back feels cool again, we can step forward. And all the time crossing our fingers that no one actually gets burned if we get too close. That to me is just not sustainable learning. It lacks stability and factors needed for successful learning no matter what model we are in. We need to slow down. Thanks for your time.
Thank you.
That seems to be it.
Seeing no more public comment, we will close public comment. We move to the consent agenda. Do we have warrants, Mr. Cole?
Yes, we have one warrant. I move that the following named bills of the Newburyport Public Schools amounting in the aggregate $697,792.37 be approved and forwarded to the city auditor for payment. There are no conflicts.
Second. Discussion. Hearing none, all those in favor?
Aye.
Aye. Opposed? Passes unanimously. We have a set of minutes for 9/8/2020. Do I have a motion to approve?
There's a change.
Right, let's get a second. And
Yeah, sorry. Yeah.
Do I have a second?
Second.
Second, Sheila Spalding, thank you. Recommendations, changes?
Yeah, I just noticed that David and I's name was combined into one person, David Callahan.
Okay.
I don't know, I'll send it to you though, but it's fine. It's more funny than anything.
Page 3.
Page 3.
Are you sure you didn't say the exact same thing?
Do you guys gonna flip a coin to see who gets credit for the comment?
I'll let you know, Ms. Kennedy.
Additional comments?
Yeah, I'll say maybe this is a function of my speaking up through the mask, but this, and there's another comment that is attributed to me on the next page, that they just don't make any sense as written. So if we read the thing that David Callahan said, said the only innovation, including Black Lives Matter, is that the organization itself may be bigger than he realized, funding things, involving things, doing things. So, I mean, the second sentence, he had no issue with the sentiment, but as soon as you say we're supporting the organization, it takes it to another level. So that sentence, but that first sentence, I don't know what that means. So I think.
Do you recall your comment? Because I think I might.
I recall the second sentence. I don't know what.
Yeah, I think the first sentence had to do with your sharing with us that Black Lives Matter was actually an organization in addition to being a movement, and that we needed to be careful that we weren't endorsing an organization as much as a set of ideas.
Yeah, I mean, that's the gist of it. I don't know if the process here is to try to recreate the general gist of a comment or strike things that aren't written as.
You can strike it, that's fine.
So if we could just take out that first sentence, Mrs. Kennedy, from the word said to the word things.
Sure.
And then on the next page, down on the bottom, in between two comments from the mayor, it says that I said that's fine. I could support Mr. Maddox under that. The one I drafted does it make those changes? It makes changes to include things like the recommended curriculum and not recommended to the required curriculum. And those, like, again, I know the gist of what I was talking about last week, but I don't know who Mr. Maddox is. So,
These are word for word from the.
I'm just saying, does anybody know who Mr. Maddox is?
I know, I remember Lester Maddox, but I don't think that's who you were
Okay,
talking
so
about.
I'm just saying.
Sometimes when the audio interprets it different, so I'll have to put on.
So that's what I'm saying. It could just be a function of the way my voice is coming through the mask, but we should strike that whole comment because I don't really feel like recreating it is a great idea.
You want to strike everything in that comment?
Yeah, just strike it.
Mayor Holliday.
On page 2, this isn't clear, the very last statement, if you could just strike
I
it.
can't hear you, Mayor.
Sorry, on page 2, we were talking about the calendar. I'm not sure what that last statement on page 2 is, said we have a calendar through December. That's not what we were talking about. We were talking about professional development and early release days only, not that we only have a calendar through December. We have a year calendar, we just addressed a portion of it. So just strike that whole sentence, please.
Additional comments? Hearing none. So the motion is to approve these minutes with the noted changes. All those in favor?
Aye.
Aye. Opposed? None. Superintendent, I will turn this over to you now, and I think you will be turning it over to other people as well.
Yes, thank you very much. I know we've received some public comment and comments on the reopening plans. And what we submitted to the school committee and also the city council. But I would also like to introduce some of our healthcare professionals and the people that we've been working with since July in the audience to really, I think, answer questions that they may have heard through public comment, and also if school committee has questions for us. And at our education meeting, we were talking about, you know, I think for all of us, this is very unpredictable times. And as educators, we're all about planning. I mean, we, you know, from the teacher, we're doing lesson plans. From the business side, we're planning on our funding. Superintendent, we're planning on reopening. So for all of us, our nature as educators is planning. And I think the virus and the pandemic that we've been dealing with since March has really really thrown a kind of wrench into education and the planning and transitioning and all of the things that we're accustomed to doing, I think, very well. So for us, we're very fortunate in Newburyport to have healthcare professionals that are working with us, really identifying the health matrix, and really on a day-to-day basis, it's their job not only to look at the data, but it's what their job is really dealing with this virus and this pandemic. So for us, it's been, you know, as a district, it's been very beneficial. We're experts at the operation piece, and we're bringing health experts to the table that can guide us and give us information on what's the safe way of approaching this really unprecedented times. And the data and the information that we receive on a daily or a weekly basis is fluid, it changes, but we can rely on our healthcare professionals to guide us in the planning. So instead of, I think, for me to go through this whole model, I would like to have Dr. Sue, Mike Gallard, and also Frank G, and Kathy Riccio, who's in the audience. But I would really like to have them maybe come to the table, come to the mic up front, just kind of give you our background. And I think there's a lot of people that we're hearing from that are thinking these metrics that have been developed are coming from the superintendent's office or the school department, when we're really relying on our healthcare professionals to guide us with the reopening, with the different learning models. And I think it would be really important to have them kind of introduce themselves, give their background. And we've been working with them since July. I think after the 4th of July, when we started to receive guidance from the DESE on reopening, they've been really instrumental in really guiding us. So I would like to have maybe Mike, Dr. Sue, would you want to come up first, and then Mike Allard right after you? And I think names have been, we keep saying Dr. Sue and Mike Allard, but now people, that are watching if you can just give a little background and kind of the work that we've been doing together.
Sure, thanks. Hi, it's nice to be able to talk to everyone both here in this room and those who are remote. I know a lot of you already know me, so I'll keep this brief, but also be somewhat relevant to some of the questions that were asked. My name is Dr. Jessica Lasky Sue. I have a background of over 20 years studying multiple complex diseases, but really have focused the last 15 years on asthma, COPD, and lung diseases. So to the point about expertise, I have probably over 100 publications in asthma, COPD, and various aspects of pulmonary lung function, and look at that and work very closely with pulmonary critical care doctors in that area. I also have 2 COVID-based grants looking at COVID severity in hospitalized patients, as well as issues like that deal with both electronic medical records within the hospital, but also larger epidemiological studies throughout the local area with a focus in Massachusetts. So I'm looking at all these data all the time and looking at it from both the epidemiological implications, but also from the aspect of the physiology of what's going on as disease becomes more severe, the various inflammatory cascades. And I'm actually the president of the International Metabolomics Society that really specializes in looking at these specific metabolic inflammatory cascades that we see as one of the crucial aspects of the people who respond more poorly in COVID scenarios. So that, with a little bit of background about the scientific background, in terms of the practical background, I have 4 children, 1 child in each of the different schools that are represented, and certainly am sympathetic to both wanting our kids to be back in school as much as possible, but wanting to do so in a safe way for our community. So with that, I'll let Mike Allen go.
All right.
Good evening. It's great to see everybody. So my name is Mike Allard, and like Dr. Sue, I too have 4 children, all of who've come up through the Newburyport health system, then I interchange it, Newburyport education system. 3 of whom, 1 is on to college, but 3 of whom are still in the Newburyport High School. My day job is I am one of the founding members and run the home base program, which is a partnership of Mass General Hospital and the Boston Red Sox. It's the largest and first of its kind private sector program in the country that are treating our veterans who are suffering from post-traumatic stress disorder and traumatic brain injury. And we are a national program that treats our veterans and their families from across the region, but also from those who come from all over the United States to Boston to receive this care. So I understand, and I've been running the program since 2009, and I've been at Mass General for over 21 years as an administrator at the hospital. When I'm not doing that day job, I sometimes venture off into some other endeavors, and had the great distinction of being asked by Governor Baker and his administration in March, at the end of March, to stand up New England's largest COVID-positive field hospital at the Boston Convention Center. If you were following the news, many of you heard that referred to as Boston Hope. And it was a remarkable experience, and not unlike, I think, in some ways, what our educators are facing, in which you have a critical mission to do something on a deadline. And in this case, it was about 10 days in which we had to build the field hospital, employ about 1,000 new employees, and get it up and running so that we could decant the hospitals from the greater Boston area who were either subacute or post-acute coming off the ICU floors and into the field hospital. And when we think about real-time data and how that affects decision-making, there's certainly a science, and we need to pay attention to the science. But there's also looking at that data and trying to understand all the variables that are behind it. And that's some of the things that we certainly experienced at Boston Hope, and trying to understand where COVID positive patients were coming in, both in terms of the emergency departments and then the criteria for which they were going to be exiting, and when they needed to come to the Boston Hope Hospital. And so for us, and going through this experience coming home, because I finally got home in June after being deployed down there for about 3 months, and coming into the educational environment, it was remarkable to see both the similarities, but also a lot more of the complexities that I think exist in the educational environment. And, you know, for what it's worth, I've been incredibly impressed with the teachers, the healthcare administrators who are working tirelessly, and the administration itself, to be able to create this environment, which is not easy. And I just want to echo Dr. Sue in saying this is a very dynamic, fluid situation. Data does change weekly, as we know, and we very much want our children to have as a consistent experience as they can. All the while, we want to make sure that we are safe and being as thoughtful as we can with any upcoming decisions that are before certainly all of you. So I've been very honored to be a part of this. I hope I can continue to help and answer any questions that you folks may have.
Great. And then also, Frank, would you want to come on up and just, I think everyone knows you, Frank, but there could be some viewers out there.
Good evening, everyone. My name is Frank Giacalone. I am the Director of Public Health for the City of Newburyport. I've been with the city 5 wonderful years, and since then I just can't believe what this pandemic is actually doing, and it's constantly evolving. But with my department, we are in communication with the state on a daily basis as numbers change and cases go up. We are fortunate that we do have a green level right now, so we're a low-risk community. And in working with Superintendent Gallagher, I think that this plan addressed a lot of the issues and concerns that are related to public health, in terms of trying to get this not to spread and spike here in Newburyport. So with the social distancing of the tables, where the recommendation of 3 feet was not even considered, which was we're very happy about, and the contact tracing, where we're in communication with Kathy Riccio as well for any cases that might pop up. So we have a lot of support from the Public Health Department and the school department to try to get the kids back as quickly as possible, but it has to be done in a safe and methodical way. And the way the data changes on a daily basis, it's critical that we have the most up-to-date data, and I think this plan addresses that with the options of when to progress, either increase the population at the schools, go with total remote or total in classroom, but that is going to be, I feel, a little bit down the road a bit, seeing that we just opened schools. So we need to get the real-time data as well to see if what all the measures that are in place works. So I'll be glad to answer any questions that you may have regarding that.
Thank you.
Yes, ma'am.
Frank, would you please, the first person who spoke in public comment asked questions about how we collect data about positive cases. And I was wondering if you could just talk about that, like college students who go off to college or Newburyport residents. How is it determined a positive case in Newburyport, and how is that added to our data?
Positive cases, we get informed, if it's a Newburyport resident, we get informed through what we call the Maven system, and we get a text alert, and then we know to go onto the database, and it'll have the case information there. So then we start our investigation, the contact tracing, which is very vital, so it won't spread. So we want to know, first thing is when the person had symptoms, if they did, or if they didn't. We start the clock for any isolation of that case with the testing. 10 days after testing, that's the isolation period. If they show symptoms, it will be 10 days from the first day that they showed symptoms. And then it mushrooms out. Who were the close contacts? Close contacts are someone that's within 6 feet for 15 minutes. And that is also a loaded question as well, because 15 minutes is not just at one sitting. It could be spaced out throughout, depending on the situation again. So it changes. We can't even get a definitive answer from the state. They said you need to take it as a case-by-case basis. So it's that close contact that we need to have quarantined for the 14 days. And even if they test negative, they still have to complete that quarantine process as well. And the information that we get, because it's personal and sensitive, we just can't give that out to the general public as well. We keep on getting questions saying, we want to know who this person is to stop the spread. But I can assure you that with the daily calls we have with these contacts, we make sure that they are quarantined properly, and we do a follow-up with our public health nurse on that. And
Thank you.
Did that answer your question?
Mr. Callahan.
Hey, I have a question. It's actually happened to come up today, so I've forgotten about it until just now. So today's Boston.com has the mass removed 4 states from the exemptions.
I'm sorry?
The mass removed 4 states from the exempt, from the safe state list for people to come here, travel people. So that map shows basically the entire country in red, except for a handful of New England states that are white, right? And then the article talks about how the data they're getting, and it gives you a link to covidexitstrategy.org, which shows a totally different map. So where is the data that the public is reading in the newspaper coming from if its own reference is something that's totally independent and not the same?
Which data are we talking about?
So this
right
is
now?
today's Boston.com, right? It says it put Jersey back in the red. So only the people in these states can go back and forth into Massachusetts.
For the travel states.
Right? But within this article, it says that Massachusetts does not meet its own criteria to be classified as lower risk. And then it links you to this, which it's not all red. The whole West Coast is yellow. So what is the correct data? And a lot of the stuff the parents have been asking, I sent Dr. Sue one that was, 6 pages.
The data
How do we know which ones are right?
The data that we get for the positive cases are based on a 14-day window. And during those 14 days, it's based on population per number of confirmed cases per 100,000. And that's where the level would rise or lower. So when we were in the yellow, we had a spike of about 5 positive cases. And it could be as little as that that's going to change the risk level. So with that 14-day window, we had very low positive cases, and we dropped back down to a green. In terms of the data, it could be from the CDC that you might have some different numbers, but on the state website, the MDPH, there is a single database. Even for travelers, they're supposed to log on and answer those questions and obviously get tested. But that's hard to follow up because it's all based on the honor system. when we know of people traveling, especially in City Hall, that if they did, we make sure that they're on that, and the health department has a way of accessing the portal, so we know who has traveled and who has reported. Thanks.
And we have Dr. Sue and also Mike Allard and Kathy Riccio. You're always here, so if they have anybody have questions. I know there was a lot of questions, Dr. Sue, on that phase 3 aspect. So, and actually even November 2nd, if you could just talk through the metrics and kind of what the thought process was with that.
Yeah, and I want to thank a lot of the people who spoke, because I think that a lot of good points were raised, and there are a lot of things that probably, I think as the team of people who put that together look at it, need to be clarified. And so I think some of that will really help with some of the questions. And I think looking at this with some of the very specific questions, the specific criteria, of what we had put together as potential ways to be full in person. A lot of people mentioned, well, the vaccine's going to be a long time away. The clarifier there was, and this was really not, I think when we all look back on it, we'll reflect and agree, not clear that any of the mechanisms, so if the state says it's okay, we're changing these criteria, we're now changing the recommendations and this is the case, or these specific guidelines that we've been going by this whole time, we're now taking this part out. Anytime that happens on a state level, if those changes happen, then we can reevaluate what we would be able to do in terms of potential implications with bringing people back. So it does not necessitate a vaccine that is given to everyone to go back. I'll give you one example. I actually think I agree with a lot of people who spoke that the vaccine, but by the time it gets to us, and even, we don't even know the efficacy of it, but that is going to be a ways off. But something that is perhaps more realistic in a shorter term are some of these ultra cheap, fast rapid tests that have started to emerge that are, you can buy like 100 of them for pretty inexpensively. Now, I don't know all the data about the testing parameters of that for like sensitivity, specificity, PPV, et cetera. But let's say that was something that now became readily available in our community and everyone could test themselves every day before school. Certainly that would have a dramatic impact on this entire situation and could be a potential viable way where then our whole system, we are then able to reevaluate to bring people back. So certainly that list, I agree, was not clear in terms of, I think it read as if every single thing needed to be met, but the intent was no. And I think in this case, we're really relying on the state in terms of guidelines and saying, okay, this is a new step, and that feedback from them of saying we're changing this part before we would move on. But it's certainly not a vaccine that's disseminated to everyone. That was an example of if that did happen, it would certainly indicate changing direction fully and not worrying about a lot of things that now we're spending a lot of time worrying about. Some other great points that I thought were brought up that I think as a team we would agree should be clarified in the document was the point and the clarification of averages of things over a period of 3 weeks. As someone who looks at data, and inherently I'm a statistician, I hate outliers, and I think when it comes to looking at something that is a robust change, one of the imperative things of that, right, is to look at things like averages. So certainly when we see a spike, particularly if that spike is explainable, I think that doesn't mean, okay, all of a sudden we go back, we change directions. And so the idea of changing that to the 3 weeks, I think that's certainly something that I would think the team would agree with, and that was really in the essence of what we were trying to communicate. One of the other important points that I think needs to be emphasized and also came up in a lot of the specific questions was as we listed criteria of things that we were considering, I think one thing we all need to be sympathetic to is in the current environment, every case that we've had so far, and we've had 4, has been situational in a very specific ways. There are, the contact tracing has indicated different ways that we handle that person, different people who we indicate this to. While we are using the general guidelines that are specified in the CDC and on a state level, each case is really, our reaction is sort of tailored to that case. Similarly, when we see cases on the level of the larger community, whether it be the outbreak in Merrimack College or the more recent outbreak in Middleton, we have to recognize that each one of these things are situational and ask fundamental questions. For example, is the outbreak in Middleton that we know is isolated to a specific community, is that relevant, and how does that impact our community, and how does that impact our schools? And this is where I think, while we have listed guidelines, when there's scenarios that we know really are not impacting us in that larger, more robust way of averaging things over time, or we know it's a particular situation, does that mean now that all of a sudden we're in red and we have to immediately switch to remote? No, I think this is an example where we have criteria, but we need to have some level of latitude to say, well, this scenario really, when it's isolated to one facility and the individuals are largely only in that facility, that's not really mandating that we should move to remote, because that's really not affecting us. And I think this is where, as much as it may be difficult to say, every single, we can't have a perfect algorithm for every scenario. I think we have to appreciate that each scenario at this time needs to be thought of carefully, and our response needs to be appropriate. So in the case of, let's say, the outbreak at Merrimack College or in Middleton, where, I would argue really neither one of those, even if those towns go red, would necessarily mandate us changing and going remotely, because we know enough about the scenario to know that's not a broad level impact. And it also doesn't impact a 3-week average in those numbers. There may be other cases where the opposite occurs. And in even the most recent communication that went out of that outbreak in the school in terms of people that are being tested. Now, we don't know that particularly what's going to come out from that, but one can imagine a scenario where, let's say, something much more relevant to us in our local community happens, where maybe the metrics of our town don't necessarily change, because maybe some of the people who this is affecting that are relevant to our school don't actually live in our town, but create a dangerous scenario in our schools. Yet the metrics that we wrote down are not met. But this is now a serious issue, because there are a significant number of positive cases in the school. That is something, again, that we may not be looking directly at the criteria that is listed, but may mandate a response to do something more extreme to protect the safety of our school. And so I just want to give those as examples of, we are trying to set a general framework. Yet I think it's important that in all these cases, we really do look at them one by one. We don't consider outlying things that happen to have a dramatic effect on us if we can really sit back and look and say, that's not really having a huge effect on our particular school. And do this in a measured, thoughtful way for each incident. And one thing I have to say is I really have to give Kathy Riccio a tremendous amount of gratitude, because I think in the events that have happened so far in our school with the cases, each one has been treated slightly differently. But I'm really grateful and happy to say that when we look back retrospectively, we've made the right call in pretty much in all the cases, and really have prevented any further spread. And so I think that's just my overall thought that I wanted to bring out to the people who had questions, but also to you here, that aspect that while we have criteria, we also need to have some flexibility.
Great. while we have Mike Allard, would you also come on up? Mike assisted us with a lot of our safety protocols, health protocols, working with Kathy Riccio and the nursing staff, and can probably follow up on a lot of the points that Dr. Sue made. As you develop the health and safety protocols for the hospitals in Boston, and maybe that unknown and how things even change in your job on a daily basis.
Yeah, so, it was, pretty remarkable when you look at a set of criteria that's coming, and to the credit, I think, of everybody who was involved, despite that, there were certain standards, to Dr. Sue's point, where it may say 3 feet apart between desks. When you get into the practicalities of looking at 2 desks that are 3 feet apart, and somebody's going to be walking down the middle of that aisle, that 3 feet becomes 1.5 feet pretty soon. And so, I think when the measures were developed to be able to be incredibly safe, and then put everything and as much as they could in place prior to the school year, because the reality is, and we've seen this, we are going to get COVID positive people in our community. It's already happened. It will happen more. The question is the protocols that the team has developed and continues to evolve with to try and create a safe environment is absolutely critical. And I think one of the things that I know we've talked about, and it bears reminding, we are still first in the first surge. We have not gotten to the second surge. So that creates, unfortunately for all of us, a dynamic in which you do create this framework because you need some elements of metrics to go by. But as Dr. Sue said, when we look at all the different factors that may come into play, it does require looking at them holistically, in addition to what obviously our governor and our local officials have determined. So part of my message for the school committee is to be able to look at this and be cautious, knowing that there are people in this community and working in the school systems want those children back, but at the same time being able to continue what I think has been a very good start within the school community, where looking at it through the eyes of my own kids, it was a great orientation. Today my daughter went into her 9th grade class. It's the first time, other than orientation, as a 9th grader that she's been in school, and it went well. And that's a good news story. I think hopefully our trend lines in our community will continue such that we see these larger group of averages maintaining at a low level. And I agree, I think a 3-week average is actually something to consider, and we'll be able to get to that stage. But I think, as you guys know, there are some interesting windows of time that we have in which we will get to the holidays that will create another interesting element, not just in our school systems, but I think also in our more global communities where people regather. We're all indoors a lot more, and the potential for more infection is a strong possibility. So happy to answer any further questions, but.
Mr. Hockhauser.
I have a couple questions, and I guess I'll start with you because you're standing there. And this is gonna, it feels like a little bit putting you on the spot, so I'll just let you right off the hook and tell you, in the long term, I'm thinking about how long we might be in this situation, right? And then what I'll call the pseudo myth of, if we were just a little bit more creative, we could have kids back by using alternative spaces, that sort of thing, which we all know is a lot more difficult than it sounds, right? Even the New York Times published this article about, they had 40 kids in a tent in the Spanish influenza with a, barrel fire in the middle kind of thing. Could you imagine, after your experience putting together a hospital like you did, could you imagine a way, though, that if there were resources, that we could create some spaces? Like, if this goes on for too long, and I'll reiterate again, my major concern are the youngest kids, K through 4, whom I think need more direct instruction than most people and more skilled, the literacy instruction and the numeracy. Could you envision a way to get either to make sure we can maintain what we have, if not even bring them all back somehow? Like, it to me sounds like that's where your expertise would really, we would go from being creative to being, experienced.
Yeah, so in my experience, anything's possible. It usually starts with some creativity, a lot of money, but I think from setting up the field hospital, we had one big advantage. It was the Boston Convention Center, 3 football fields long, 2.5 football fields wide. And we could fit 1,500 patients if we had really surged up to the capacity on the floor of that field hospital, plus the surrounding perimeter. So I think it really does start with the discussion around space, and having the capability from a space standpoint to be able to be safe. As we think about it now, if we get more rapid testing, as was mentioned, I think there are some game changers out there that can reconceive, and I think this is the part of the balance here, because right now it may be space, which is very cost intensive and very difficult to acquire, but that doesn't mean you can't get creative around that. But looking down the next couple months, we know that Yale has developed a saliva-based test that does have a much more rapid turnaround that's being distributed throughout the Northeast and the country now. Not everybody's going to have that accessible. Eventually, if there could be even more dynamic tests that the civilian can use, that could come into play. So you could end up, and I'm throwing this number out just as a hypothetical, you could end up spending $200 million on this great new facility, only to find out that in January we've got this plethora of rapid tests, and that facility isn't necessarily useful anymore.
It's like an Olympic stadium.
Right.
Additional questions? Yeah, I sort of had one, and this came up in an earlier meeting today. We talk about sort of the cold number of cases, and also the need to sort of see things on an individual basis. So 6 cases in the community might not be a problem. If those 6 cases are concentrated in one school, we need to really think about what's going on and what's happening. So that whole idea of almost on a case-by-case basis, taking a look at a lot of information. 6 may not seem like a lot, but if the 6 is in one school, suddenly we may have to respond differently. Is that sort of a clarifying statement about what some of the challenges are?
I would agree with that. Yeah.
That's exactly what I think we're trying to say.
Yeah, I think over the summer we had heard about, in a parallel comparison perhaps, a lot of parties on Cape Cod that had all of a sudden been super spreader events. So that actually spiked the Massachusetts COVID positive rate for that week. Now, does that mean the rest of Massachusetts is affected by that? Well, some communities may have been, but not as much the case. And so I think your clarification is spot on.
Additional questions? Mr. Ackerser.
Do you think it's possible to start now? I know you just talked about you don't want to spend $200 million on a facility, then find out a couple months. But do you think it's possible to start now to think about what do we do in the spring to get more kids back if we're still, if we do get the second surge and then we come and it's March and now we're thinking about being outside, but we still, we're still barely at halftime for hybrid. Do you think it's too early to start thinking about what could that look like? What would it cost? What are the parameters so that we're prepared? A lot of people think that if we knew what September would look like in April, we could have spent all those months planning for it, but we didn't. And so in hindsight, I'm trying to think, and I think a lot of the questions we're getting from the community was, what would it take And I don't know if it's too early, definitely not my expertise, so I don't know if it's too early to start thinking, like, what could we do? What are possibilities?
Yeah, I don't think it's too early at all. And I know when we look at the Mass General Brigham Health System, you know, they're collectively looking towards July of next year about how the workforce, if you're not patient-facing, it's work remotely through that time period, thinking about sort of trend lines that we could possibly predict. And so, you know, I think we will know a lot by the time January and February rolls around, much in the way that we've seen a lot of learnings through this period of time. I do think wargaming out some scenarios is important to do right now, for sure.
Additional questions, comments, thoughts? Have we covered some of the most germane questions, do you think, that we have been receiving?
Yeah, I guess just one thing we heard in the comments was about the state recommendations, right? If the state says it's safe to go down to 3 feet, why aren't we doing 3 feet? That kind of thing. Dr. Sue, I think you spoke a little bit to it, but you know, like I'm thinking later on tonight, the school committee is going to talk about whether or not we're going to support a state school committee motion to put off MCAS testing. Right? The state says you absolutely need to do MCAS, and we're about to say, don't really know. So I think just listening to you guys speak and then like just bouncing that off the comments we got earlier, is it safe to say that sometimes the state metrics and the state suggestions aren't what we should necessarily be listening to locally?
I'll let Dr. Sue give her perspective. What I would say is obviously it's sort of the minimum, right? So I think certainly where state recommendations are for a certain number or a certain element as a baseline, I think that's the starting point. In some cases that can, you know, be the right answer. But in other cases, I mean, you know, I think this community's been very fortunate at how low it has been. And so, you know, I think if there are additional steps that don't upset the apple cart, and of course that's the trick, then yeah, sometimes you can go above what the state is requiring or in a different direction if it doesn't interfere.
Yeah, and I know that you also spoke to this as well, the 6 feet. I think, you know, one thing that's difficult, even looking at this, that you know, you sort of highlighted, is even the fact that at the state level, right, there were conflicting guidelines on this. I think one thing that we certainly can say, and that was mentioned, you know, right now, if you look at the distance of the 3 feet metric, as soon as you have a 3 feet metric and you have one person walking up and down that aisle, that 3 feet metric becomes less than a foot on each side. And I think that those are the things we need to be thinking about. And it doesn't take a PhD to sort of say that, you know, there's some concern once we get to that distance, and we know these are kids who aren't necessarily always following mask guidelines and regulations, and they're putting them down and this and that. So for now, I think 6 feet is really the precautionary thing to have in place. Now, I think one of the things we have to look at is evidence and data. And one of the things we do see, right, is in the cases that we've had so far with the protective measures we've put in place, we haven't seen spread. Now, if we cut that in half, now I'm not saying we know exactly what we'll see. We do know, though, what we've seen in other settings where desks have been reduced to 3 feet, and with someone walking up and down. So now you're at a point where, you know, on either side, you know, you're really within much less than a foot. And you know, those guidelines, even if when that happens, even the parameter of the space and what's coming out of the mask is being violated. And especially in the case of the aerosol cough, which someone mentioned earlier, you know, that in school, and when that happens and everyone looks and gets nervous. And And I think we need to just respect the virus and respect that these things are happening and that this can happen, right? I think for right now, we need to maintain some level of equilibrium as we are having on average 1 case a week, and make sure that we are maintaining that in an equilibrium, and that this isn't starting to go up simultaneous with a point in time with the fall, knowing that cases are going to be going up. So I would argue that, especially given that right now we know, and we are seeing by the data throughout the nation, that cases are going up, that I do not believe it's time to start laxing the 6-foot guideline that was originally put in place, simply from the fact of the matter that you know, even if you said 3 feet, is immediately when you have someone walking down the aisle of a 6-foot, you're 3 feet. Any other questions about that?
I guess my last question is for the superintendent, which is about, like, now that we have all this thinking and we understand the data and how we're going to look at it, like, what's the process? So, you know, from the lay perspective, I know the state puts out that report every Wednesday afternoon, but that's about all I know. And if we get a report on Wednesday, like, how do we read it, and how are we going to know when we're going to open, and how, like, you know what I'm saying? Like, what's...
Right, and I think that's, you know, for us, as a district, we're fortunate because Dr. Sue's looking at that data pretty much on a daily basis and is speaking with Kathy Riccio on a daily basis, you know, as we look at that. I think one of the important pieces for tonight is, you know, this metrics that has been developed, you know, as the virus, it's a fluid document, and we're going to continue to work together. As Dr. Sue said, maybe identifying more specifics, you know, in the document, but we're going to adjust and adapt, I think, to a lot of the things that are happening on the ground. So I think for us, moving into the summertime, with how, you know, in working with our task force and the medical professionals here, we didn't have the luxury of bringing you know, a whole community in and doing focus groups like we normally do. And at the education committee, just on my previous experience as a high school principal on a high school schedule change, that took like a whole year with different focus groups and getting feedback. But when the guidelines were being released through the state per week, we were adjusting and accommodating those. It was really fast and furious to get back to a reopening plan where our goal in Newburyport was to have some sort of in-person, it's our #1 priority, in the safest way possible. So now that we're in a hybrid model and the high school started today, I think it gives us a little time. I don't want to say breathing time because everything's so constant, but I think it gives us a little more time working with our health professionals in the school community to really go back and to try to create more of a process and communication, you know, with the community. But from after July 4th to July 31st, we were getting guidance per week, so we didn't have the luxury of sifting through a lot of information. So I think, you know, moving into the school year and working with the people that we've been working with since July, I think we can strategize on ways to communicate and work on that process. But as we were saying, you know, working with Dr. Sue and Kathy Riccio, they're speaking on a daily basis and monitoring a lot of the health data.
So we're right now talking about November 2nd. And we think people might know if that's if that's feasible by, like...
In our plan, I think we had a decision on October 19th as we were looking at the health metrics.
Yes, so one of the clarifying factors of the team of us who put it together in terms of the dates, particularly with the opening phases, and, you know, looking at also being cautious not to look at just spikes, but to looking at things over averages, is that timeframe was specifically specified because it enables us to have in the high school, because it's a 2-week rotation, that we'll have one full rotation of high school students, and then we will have a second full rotation. But during that second full rotation, if there was a case or anything the first time, it enables us 2 weeks to assess any potential exposure the first time. So the 4-week increment was used on purpose, specifically with regard to looking at the high school and the potential effects of that, and the fact that it is a 2-week cycle to get through the different, all the students in the high school.
And the other piece that was, we'll report today, but we did have high school students back today. And I think the more that students are back with the faculty, you start to develop the systems and the protocols, and the students and the faculty adjust following those throughout the day. So we also want to have that comfort level where students and staff are comfortable, going through a couple cycles with 25%, looking at our data, and then increasing that. So I think that was, when I was over at the high school today talking to students, they were glad to be back. And I think, talking to Principal Wolf, that was a good test in kids getting confident and staff getting confident with people in the building. So that gives us a good 2 weeks for that, those 2 cycles rotation.
Sean, I have a question. That date is very close to Halloween. Is there any concern for that? I have concern for kids coming back after possibly being exposed and perhaps not testing positive yet, but they could be spreading the virus.
Yeah, and I think all holidays concern us, and that's something that working with our team over here is always one of our discussions. What are the holidays going to look like, and monitoring that. And our goal is to constantly stay in person as long as we can, and we're hoping that I think we're going to need a lot of community support with this. This isn't just within the schools. I think we're feeling comfortable with our safety protocols and working with students with structure, that they are following, wearing masks, the social distancing, hand washing. But I think we're also, for our community, really need support outside of school, and working with our children and families to follow the same health protocols outside. So that's something that we're looking at with Halloween and those holidays. Absolutely.
Mr. Reardon.
This might be more of a question for maybe next time. So our next meeting then is the 19th. I guess I would like to hear from, maybe Principal Wolf then, and just see how those 2 weeks have gone. And then, what does 50% look like? How does that change what they're already doing? I'm just curious, like I said, because I do think those weeks are going to come up pretty quick, and I don't think obviously it doesn't affect K-8 at all. We're just we're just adding
a day,
that Wednesday day. So it's really just high school going forward the next couple of months as far as
correct. Bringing more students back and looking at those learning spaces.
Yeah.
I have a question, I think, for Kathy Riccio. When a student tests positive, what happens with their siblings? So if a student is quarantining and they have siblings that are also in the school districts, will they also be asked to quarantine? How's that handled?
So if a student or a family member tests positive, then that whole family is a close contact to the student. So then they would be asked to quarantine for 14 days. The COVID patient positive is isolated for 10.
Okay.
So but that's kind of how the virus works. So I just was pulling data from our nursing software program. We've been in school 11 days. So in the 11 days, we've had 60 injury visits, 174, and this is no high school, so remember. 174 illness visits, mainly the Illness visits were respiratory, gastrointestinal, general illness, fatigue, headache. 72 medication administration, 155 treatments, 93 other health office visits. Non-encounter activities means case management, absentee investigations, telephone calls to parents. Students dismissed from school for illness, suspected COVID, 23. So that would be if we would have 2 different symptoms, if the symptoms lead you, you can kind of get a sense of when you're kind of wondering, you want to get it ruled out. So it's not that we're instantly assuming something, you want to rule it out. And that's your instinct tells you that. So, and the families then were asked, we also can't have people with a bunch of symptoms in school. So we're asking everyone, stay home till you get your symptoms resolved, either get a differential diagnosis or get it ruled out, and then you're back in school again real quick. And so then we have had since 11 days, 2 student positive COVID cases, 2 staff positive COVID cases. We currently have 23 students quarantining. We currently have 11 staff quarantining. Absence days due to illness has been 102. Absence days due to quarantine, right now 24, but that's going to increase starting tomorrow. So the question about exactly how is the communication going to happen regarding watching the virus and how it impacts this community, Mr. Hawkeiser was asking that. So I think you can see the fact that every day the virus reacts differently in your community. And so when, everyone here in this team, we look at the statistics, but we also situationally look at what is individually happening with, especially I'm keyed into what's going on inside the schools. So that's, every day you look at what's going on inside and how's that going to impact. But I would say once a week we gather together discussing what is currently happening. Is there anything we're worried about that's going to be impacting us within like the next 3 days that we're hearing about? Or, you just are following your instincts because this is what you've done your whole life. So we typically gather around at minimally once a week to decide how are things going. I have to thank the people that we have experience. I mean, I feel like I'm the luckiest nurse leader in the whole state, Because, who knew? I had all these parents with these expertise, and it's nice because they're the ones. Commander Allarder's the one that said, I had to convince my staff that it's safe to take care of COVID patients. Some people were scared. I had to convince them. We put the protocols in place, the safety protocols in place, and we want to give them confidence. And I appreciated that experience he shared. And I also appreciate the expertise of Dr. Sue, because I can talk with her about, I've got this situation, this is what it looks like to me, because nothing is ever exactly black and white. You've got to take and think about what you're hearing. What does the exposure sound like? What are the protective factors in place? Where should we be cautious? Because our whole goal here is to keep the schools open. That's the whole goal. But if we try to smush people in too fast, too close, you're not as safe. So we're walking the line of getting as many kids as we can in and staying safe. I don't know if that answered all the questions so far.
Yeah.
And then, of course, how many times? I talk to the Board of Health all the time, thank goodness. And I talked to you guys a couple times today. So anyways, it's really, real privilege to work with this whole team and get the guidance of the principals and Sean leading the way. And I also want to comment about, I'm also on the statewide Safe and Supportive Schools Commission. I was appointed there. So that group of people got together today because we're actually writing new guidance for creating safe and supportive schools. And so we were asked, well, how did you start your school year? Did you just instantly jump into academics, or how did you begin to react with your families and begin to address each student's individual needs or what are their concerns. And you know what? I could instantly say, wow, Newburyport, with the principal's guidance, put a 15-day plan in place to begin to address those social emotional needs. And we had a plan. And it was great to be able to say that because there were other people that are on this commission that hadn't put all those different things in place. And you can't get to academics until you meet the students' needs. And they're feeling very confident and they got their different needs met or that type. So anyways, I just wanted to put that in there because I just learned that today. Yes?
Kathy, from a ballpark point of view, you've been around a number of years, schools have opened over a number of years. The numbers of visits and number of kids that have been sent home, do you have any sense, are those numbers quantitatively different this year than they may have been in other years?
Well, this is certainly a much different start of the school year than we've ever had. And I would say my feeling around is that the kids are really happy to be walking around in the hallways. I mean, I get waves and hellos and, you know, it's kind of fun. And you can hear the laughter of the kids in the hallways too, even with masks on. To a teacher, I'll just kind of go around, how's it going, how's it going? They're like, you know, hey, it's actually great to have our kids back in the building. I mean, so back to your question. I really feel that we've not seen a huge amount. I think that with what the safety protocols and the way that the principals have designed things and the different structures we put in place with guidance from the medical advisors, because Commander Allard had really good suggestions on some certain ways to handle larger cohorts, and I appreciated that. So I think the way it looks, day 11, I don't know. I'm really hopeful. I'm thinking things are like, it's a good start. Oh.
Thank you.
Great.
Any final questions?
I have a question.
Sure.
I have a comment. You know, Councilor Khan brought this up a little bit during the Joy and Ed meeting, but again, it's not a question, but you know, we can only control what we can control in the schools. You know, outside community, we just can't. And I know I've got an uptick of emails this week from parents concerned about seeing like groups of kids not wearing masks, like up and down the street. Particularly, you know, some South End parents got in touch with me. So I guess I'm more just asking, what as a community can we do, or even as a school system, to even just, you know, beef up our outreach to, you know, kind of being all in this together. You know, right. Goal, like, you know, Council Khan brought it up in a sense, like, you know, we've got, you know, now we have this November 2nd date. That's kind of our goal, you know, especially for high school kids. You think that would be such a motivation factor to get, you know, up to 50% of kids back in school. And again, I'm just asking, like, I don't know what's being done or what's maybe talked about being done, or what else can we do to kind of, you know, keep promoting, you know, again, you know, good, solid, cautious behavior outside of school, as well as, you know, the examples we're trying to set inside school.
Yeah, I mean, on our end, communication with parents, you know, we have sent out, I think Kathy sent out communication at the beginning of the school year about all of us in this together, but I think we could reiterate that because as you said, we can only do so much in the schools, and, right. And when you see the structures in place and the students, you know, they're excited to be back and they're following along with the protocols that we have in place, but it would be very helpful, I think, for the families to continue those protocols. You know, when you're out and about, you know, they're at the skateboard park or they're riding their bikes or with friends, you know, to social distance and to keep minimum of the mask. We know how important wearing masks can be, especially if you're in different groups. So, I mean, on the school side, I think we can encourage that. I don't know how much I can enforce.
Yeah, it was more just about to the mayor. Just right. You know, as a broader question.
Well, I think you're right. It's a challenge. I think there's no question about it. And I think that's part of the reason why I started
almost weekly. I mean, I've skipped a few weeks of the PSAs that I do over at Cable on Thursday afternoons to try and update the community. And initially, a lot of people were paying attention. I mean, I think there is pandemic fatigue. I don't think there's a question about that. And as part of the reason why I issued the mandatory mask zone, because it was really getting out of control. We also ordered 2,000 masks, the white ones with the clipper ship, and so have people on the weekend who were handing out masks to people who would show up and just come up and, as they're going to put their money in the meter, say, do you happen to have a mask with you, and hand them a mask. So, we've also done, with Matter Communications, a huge video about Newburyport, and I think that's been part of the draw of people coming to the city, because they look on the website, they see a lot of information about COVID and our numbers, and they see that we have mandatory masks, and we did this whole video that with them, you bring the mask, we bring the culture, you bring the mask, we bring the, it had over 1 million hits, and it only went out in a 50-mile radius. So maybe what would help is if we did one specifically targeted towards students.
Yeah, I was thinking like kids could do PSAs for kids their age group.
Right.
And we could start showing them, spreading them out across social media, showing them in the schools, maybe like a banner contest.
Right, I think that we should explore this definitely, because I think there's no question that everything we're hearing, and Dr. Sue mentioned it too, Commander Allard, that the surge is coming. I mean, we look across the country, look what's happening in Europe, and it's, we have to do something. And, I mean, I don't want to get to the point where I have to put mulch in the skate park again. So, and I'm sure Brian doesn't want me to do that either, being a skateboarder.
If it was done properly, I wouldn't mind.
But, I mean, but this is, we put up signage, we put up, and they're just not listening to it.
Well, if I can speak again, even just being aware of what's going on around the state. I mean, how many districts now have moved to remote learning because a kid had a party and everyone's showing up. So I mean, but who knows if kids are paying attention to that stuff. So I mean, not that we need to be informing them, but I mean, that's all it takes to kind of switch what we're doing.
Right.
I mean, it's just, they might not think of that, in the moment, but, again, it can have a huge impact, not on just the school, but, the whole community.
I wonder if there's a way we can track places that they're hanging out without masks, because I do know on the bike path down near the swings that were put in near Oldies Marketplace, there's 20 kids without masks every day when I ride my bike back there. So I just wonder if in a survey it could be asked if parents have seen kids in any area in our city, so we would know to monitor those places, or perhaps put signs.
Trying to be good here.
No, you guys are doing great.
Having a moment.
You're supposed to be looking at me, and it had to be wait to be recognized to speak. We're really trying hard here tonight. Appreciate it. But then what do? I mean, I can see 10 kids in the skate park, and you go up and say, come on guys, or you see a mom pull up and drop off 6 kids, they're not related, none of them have masks, so they go in the skate park. Or you see them downtown, or you see them skateboarding in the garage, or I'm not just picking on skateboarders, or you see the kids just roaming everywhere. So without, having some type of fine or penalty to that, I mean, it's difficult to, you ask, I mean, how many times have I pleaded with parents on my PSAs to do the right thing? Know where your kids are, be sure they're with family, be sure they have masks, they're social distancing. So it becomes a real challenge in terms of, because we don't have, fines issued if you're not wearing a mask. We're trying to do a positive thing here.
It might help if Sean did a survey and he found out these areas, and if he were able to give that information to parents, because some of these parents may be working and may not be aware that their teenager is hanging out without a mask downtown. So if they know that their teenager was over in that area and that people were seen without masks, it would give them an opportunity to talk to their child.
Mr. Callahan.
I was going to ask you about the fine thing. I know there was fine mentioned months ago, but I know that kind of went away. it's.
I'm sorry, I couldn't hear you.
Fines were mentioned at one
Oh,
point.
yeah,
You know, but, anyway. So the skate park thing is funny because the superintendent will always give me a hard time about all the people in the skate park. But the funny, or not funny, disturbing part is that they're young kids, a lot of them, and the parents are sitting on lawn chairs just outside the fence, also without masks. So, you know, while they're definitely, you know, teens hanging out in the thing, it's more widespread than just like, you know, the 13-year-olds. But a second part of it, regarding the out of school, and it's only so much in our control, and this sort of towards the health director, Seabrook is right there. I don't know what the rules are, but they seem to be all over the place because you can go in one store will let as many people in as they want, one will make you wait outside. Some employees wear masks. Went to a place up near some lake and full on, like, you know, really strict. And then another place into like a sub shop and nobody had anything. So is the health department in direct, regular communication with Seabrook regarding their cases? Because, and I've said this multiple times, one of the towns on the list was Woburn, and I bet almost nobody is traveling there on a regular basis, but I bet everybody in this room has been to Seabrook multiple times. So do we, because I called them myself, and the woman said they didn't even have metrics to give the same way that, you know, we see every day for every town in Massachusetts every week we'll come out with a list.
No, we have not been in constant communication with Seabrook. They obviously have their own state guidelines for COVID. So we do monitor if there's any clusters or things like that, and we haven't seen
Okay, so you are,
anything.
not you, but the department is looking at Seabrook, Hampton, those towns that, I mean, it's an imaginary line.
Yeah, we all look at the surrounding communities to see, you know, if there's any outbreaks. And if
I know I
there's,
asked Dr. Sue about this, so I want to just clarify, because it was not in the list. The list ended at the border. So.
well, it's like we've
I'm
had.
just saying, people who live here are there all the time, whether it's to go shopping or eat. It's may as well be part of Newburyport.
Yeah, and again, New Hampshire is one of those low-risk communities that travel back and forth, even for a day, is allowable, that you don't have to call in to say that you were out of state and you don't have to quarantine or anything. So yes, obviously, if their case level went up and it put them in a different risk category, yes, we would react and accordingly.
Thank you.
You're welcome.
Mr. Hawkeiser.
I like what I like what you were saying about keeping things positive, because, you know, you can't really scold kids into compliance, but, you know, maybe some more modeling. I was going to suggest we get masks. You know, it sounds like the city has done that. Maybe we can, you know, start giving them out to the kids. Oh, I don't know if it's those masks or the white masks or something like that. Like, I know I gave my Clipper mask to my son. He was, you know, he loved it. And so maybe if there were more opportunities, they could even use those as like PBIS rewards in the schools, because that's something that everybody's wearing a mask, but, you know, so the kids could know but not know. They might be interested in that. You know, a lot of people have been asking me about consequences, because I think while kids have been happily back at school, I've also had more than one person write to me and say, my kid came home today and said, you know, everyone's got their masks under their noses. And the kids are walking around the halls. I think we got one email talking about, you know, 10 minutes between classes at the high school. Kids are hanging out, kids aren't wearing their masks, that sort of thing. And maybe that's something that over time the protocol picks up. But like, we really don't have, schools can't send kids home for many things at all. I mean, it's a legislated thing, so I don't know how to get around that, but it is going to have to be a positive culture-built piece that gets kids wearing the masks more often. Like, you know, Mr. Gallagher, maybe you know differently, but kids, you can't send a kid home if they show up without a mask.
Well, we will. So
I'm just saying, like, you know, I'm just telling you, like, I think you know as well as I do, there are very few things you can send a kid home for.
So, yeah.
So it becomes difficult. one of the places, thinking about what Sheila was saying, that I continue to see people congregating are in local sports leagues. The softball fields, when I drive by every day, I think it's the flag football practices over at the lawn in Moseley, but the parents hanging out on the sidelines without masks. The people at the fields on Merrimack without masks. So I think those are places of natural congregation. Basketball courts down at Cashman, that kind of thing. It's where groups of 10 to 15 multi-age kids can come together and all have to be contact traced out of school for a little while. Because I think there are a lot of sports leagues, both local and like AAU leagues, still going on. People have been playing basketball. Our kids have been playing basketball inside all summer. And so I don't know if we know who the people running those leagues are, but maybe we could push some outreach, because my experience is coaches have a ton of influence over kids. And if coaches can enforce kids having masks on the sidelines, even if not on the court, even driving by and watching the soccer practices along Low Street, some have masks, some don't have masks. I think that's a good leverage spot.
All right. Pause for a moment. Wearing medical scrubs, not wearing a mask, bring a lunch to his kid at the skate park. That was very disheartening.
I think the other thing that we probably can do, and I'm sure that because these leagues are setting up times with the schools and with Kyle and through Lise Reed, through our parks, is that we now can pass a policy within any of the leagues, any organized sports who use the fields. These are the requirements that you have to follow, and if you are found by not to be following, then your permit is pulled. I mean, we could do something like that, at least trying to set that tone.
Well, I know the state's trying to regulate some of those leagues too. I think Newburyport Youth Soccer has done a great job. I'm there every Saturday at the fields at Cherry Hill, and I know Massachusetts Soccer was there to check out the operation this past weekend, and I thought they were doing a pretty good job.
Okay.
All right. Thank you very much for our folks who gave us a lot of time tonight.
Thank you, appreciate it.
And for the work you've done. Let me just run through the agenda for the balance of the meeting so we sort of have an understanding. Item number 5 is the discussion of mask guides to conduct operations and practices. One of the things we agreed to do is to sort of review our operating norms, our principles of operation, and code of ethics. My suggestion is that we take one of them at a time over the next 3 meetings and discuss them and see which ones work, which ones don't work, whether we have a common understanding of what they are. So item number 6, tonight begins discussion of the resolutions. We don't have to vote on them tonight. We can begin the discussion. We have 2 more meetings before the annual meeting takes place, but the meeting is taking place online. And we usually designate somebody to go. If we're not going to send anybody this year, then we don't need to vote on the resolutions. And with Mr. Cole being out of the room, I think it's fair to say that he's often been the one to go.
I went last year.
Yes, you were there, yes. So we would like to send people, if we have people who are interested in holiday.
I think it's really important that we send people this year. I think that there are some really key resolutions. And I think given all that's going on in the school system, the last thing anybody needs to worry about is MCAS. Not that it needs to be pushed out for maybe 4 years, but at least until we get through this. And I think that we need to take a strong stance and support that resolution. Others we might not feel as strongly about, but that was one that really jumped out at me.
I want to wait for Mr. Cole to get back in to try to identify somebody. Are there other people here who are interested in attending online?
I'm interested. I need to clear my schedule, so I'll get back to you.
We could send more than one person, I think.
Oh, sure.
Yeah.
No, I just
you.
yeah.
He missed his trip to the Cape.
He couldn't go. That's why I
I commend and second Sheila's going. Thanks.
But it's virtual, right? No one's actually going.
Virtual,
yeah.
Oh, yeah. I mean, I'll probably log on.
I second and commend Sean's going.
Okay.
So resolution 4, the lowering the voting age, something like this. I mean, this is just like, hey, we as a community would think it'd be great, but it's clearly not legally binding in any way, right?
Right, they're not binding.
In fact, it was.
Holiday.
Thank you. It was the state rep, Vargas, I believe is his name, from payroll,
Right.
who came and met with the students at the high school. And remember, I told you I was really surprised, because there were 22 in this, what was the name of that group, Sean?
The North Shore?
Youth Advisory Council?
Oh, yes, yeah.
At the high school. And out of the 22 students, like 18 said they didn't think they should vote until 18. And that really surprised me. There were only 2 who felt that they should.
Yeah,
and other people felt that they would just follow their parents, so what's the point? So, I don't know.
That actually may be true. Okay. So what's the intent? So say we as the school committee said, sure.
So when you get there, like all these are brought up, you're like a delegate when you go in. So like you're representing the report. And then
right. We come back and we vote and we say yes.
It's just, I think it's more just a kind of a unified democratic stance that the organization is taking to the state. It's what their way of saying, like, these are the things that we'd like to see.
And Brian, we have actually, there have been times when we sent amendments in.
Right.
Saying,
Yeah, right.
Vote yes on this if this amendment is adopted. So again, the intention is not to go over these thoroughly today, just to sort of get this thing in motion. And then have a discussion on holiday.
But these also become the Mass Municipal Association representing all the, the cities and towns in the Commonwealth. They do a very similar thing at their annual meeting, and they come up with these resolutions and policy statements. So those become a unified driver of the legislative agenda for example, the teachers, the Mass Teachers Union, or the school, principals or superintendents association. And so they try to unify the school districts so that they have a set of protocols or principles of things that they really want to push the legislator forward on.
Are LGBTQ?
I'm sorry, what?
Is LGBTQ really not a protected class in civil rights legislation right now?
I don't know the answer to that question.
Well, number 9 says that they're trying to push that at the federal level. I thought that sexual orientation was
in Massachusetts.
They are in Massachusetts, but not at the federal level. Yeah.
All right.
Let's keep our fingers crossed that they will be at the federal level.
Yes.
Soon. But at this point, yeah, I know that Massachusetts has enacted that.
I think some of the unfortunate things with these is sort of what we talked about with our own equity resolution, is that it talks about some ideas, but it doesn't really give solutions. Like this one about attendance talks about waiving the monitoring of attendance, but doesn't talk about mandating supporting communities to increase their attendance.
That's your amendment.
Yeah.
What's that?
That's your amendment.
But the same thing with MCAS. Like, yeah, we can do away with the MCAS test, but I'd rather talk about how are we going to force the state to support communities to support the teaching and learning that would increase the scores on the MCAS test.
I think what Dave is saying is that he wants to attend the meeting.
No.
I second that. I certainly endorse that.
That wall already has my head impressioned right on it. Dude, I've done that. I've done that slamming. It's, you know what I'm saying? Like there's no, a lot of these seem to think that if we do away with the destructive measures that the problem goes away.
Right. The process for these is these tend to be submitted by school committees, forwarding, having a discussion, having a public discussion and saying, this is something we want to support, we'll send it into MASC and ask the entire organization to support it.
Yeah, I mean, and MASC has no political power, so it's not like we're not really influencers by any means.
I wouldn't say no political power, I would say not very much.
Not very little.
Mr. Callahan.
Can I motion that we move to number 8 since Steve's not here so that Nancy can go home?
Yeah.
Oh, no, she left.
Yeah, why don't we do that?
Steve's just talking. Oh, he's been out there for a while.
Yeah, if there's no disagreement.
Is there a second?
Second.
To what?
To move on to number 8.
They're both coming back now.
You missed it. Too late.
The motion on the floor is to jump to item 8, superintendent's report and financial and staffing updates, so that we can keep Nancy in early tonight.
Yes, right.
All those in favor? Aye.
All right.
Turn it over to you, Sean.
Ms. Lysick, part of the superintendent reports, we have 2 reports from finance and staffing update from Ms. Nancy Lysick, and then also after her, Ms. Koch will give some special education updates. So, Ms. Lysick, do you want to come on up?
I sent the reports to the school committee earlier.
Right.
We've made some changes already in what we're going to do with these savings. We used the carryover money for summer salaries, so we were able to save all of the choice money. We didn't spend any, and we still had some funds left over. So about $800,000 is our total savings. The substitutes that were removed from the budget in FY21 is going to come from the COVID grant through the month of December. Supplies and materials that were removed will come from the carryover money. And the remote academy salaries from September through December will come from the city's COVID grant. So that gives us savings as well. We have $1.5 million in choice. We budgeted $1 million. So we'll still have $500,000 left at the end of this year, even if we spend it all, which hopefully we won't. Still gives us carryover for next year. As far as staffing goes, we still have 3 full-time positions, professional positions, and we have a number of IAs that are still open. We also have CODAs, RBTs. We had 3 more people this week that went out on leave. So those positions will be posted next. Questions? Okay.
Yeah, I actually have one.
Yeah?
Nancy, I know that when we needed to make some hires over the summer, we did have a pool of candidates to choose from that had been interviewing for positions all through the spring. What is this? Do you have any sense of what the situation is out there in terms of hiring teachers? Teachers out there to hire?
It's very difficult right now for certain positions. The ones we're looking for are speech and language, school psychologists, RBT, CODAs, and instructional assistants. Those are very difficult to fill. Surprisingly, instructional assistants is, we put an ad out, we get 1, so it's very limited. I think a lot of it's what's going on in the world right now. A lot of people probably don't want to come to the schools. They're not changing positions as much as they usually are. And we're covering a lot of positions. We've had a significant amount of staff take full year leave of absences, and quite a few that have taken the 12-week leave, and that continues to grow. So they don't get a full 12 weeks now because it ends at the end of December. But they are still taking advantage of that opportunity if they need it.
Other questions for Nancy, Mr. Hopkins?
Along that line, the petition, I guess it was, that came to us from the students implied that a large portion of the high school history department is not working right now. Is that true?
We had a number of them that went out on leave. Some we have some that work in remote, and we've also replaced some.
And that we're not running the Model United Nations class?
That I don't know.
I can look, I'll have to find out on that. I think one of the advisors might be on the leave, but I'll get more details on that.
Just curious, I have no idea.
I think it's obviously going to be done a lot differently too than it has in years past, so.
Right, I mean, Model UN is not going to be a thing as it was, but.
Yeah.
There may be, again, I don't want to get into a discussion of personnel or specific personnel, but that may be something we could pick up in January and do something around.
I mean, in general, it's always a problem when you run a very specific course that's tied to a specific teacher. If something happens, it's tough to run that course. That's not, I was just curious as to.
We have been working with staff. If we have someone that for a medical reason, they can't be in the building. We've had a few that have been more than willing to work remote and handle their class.
And I'll follow up on the Model UN and are they the electives too for the 19th?
I just have questions for Nancy.
I guess I don't, Nancy, can we, and I guess you can talk from there, you can come up, but I don't really understand the choice money and the overage.
It's not really an overage. It's, the school doesn't close out as of June 30th. We have to encumber salaries for the summer for all of our teachers. They've earned the money as of June 30th, but they're paid through the summer. So normally, it's choice money.
Our contracts go to the end of the summer?
Their contract goes from September 1st to June 30th. But
Okay.
they're paid over the summer, money they've earned, because they're paid 26 pays. So that money has to be encumbered, and usually it comes from choice. The choice salaries get spent over the summer.
And by choice, you mean like the students who choose?
Right, the money we've saved in our choice salary account, yeah.
And this year we have 12, I think, families, it said in the.
But we have a significant amount of money in choice that we've been able to carry over year from year to save. So right now it's 1.5 million. We're only going to get about 226,000 this year, the choice students. We have a small number now. But that amount has built up because for the last 2 years we haven't had to use it. So this year we saved in expense money, $1 million was left over at the end of June in expenses. That was able to turn over into salary money and pay all of our summer salaries instead of using the choice money. And we still had a little bit left to cover our the supplies and materials that were reduced in the budget. So like I said, it was about $800,000 total that we were able to recoup from the money we were able to save for the year. And the savings primarily were in supplies and materials, utilities, athletics, substitutes, because we were closed.
So there was, or there still is, a surplus from what we talked about was our 9-month budget in the beginning of August?
No, the money's all accounted for. The carryover money was used for all of the salaries. The small amount that remains, the city has given us permission to carry it over into FY21, and we'll use that for supplies and materials. So it's really not, like we have a ton of extra money. We don't. We have a small amount that will cover the supplies and materials that were cut.
Because we didn't initially budget for supplies and materials?
We cut half of our budget to balance the budget.
And then we realized we're going to have more, so we're not going to use that.
Right, we were hoping that we'd have enough in savings to cover what we cut in the budget, and we did. So by saving the $700 and something thousand in choice money, That brought our choice balance up to 1.5. We budgeted $1 million. We'll still have $500,000 minimum at the end of the year to carry over so we can budget next year. The more we can save by the school committee always allowing us to use expense money for salaries, the better off we are. I mean, why spend the money in expense if you can save it? And last year we saved a significant amount. Make sense?
That choice money is the money that we don't really have restrictions on spending.
It's the only available cash that a school department has. So like the city would have free cash, we have school choice. It has to be spent on student education. So either teacher salaries or something to do with the students. You can't go out and buy furniture with it or anything, but it is the only extra money we have. So if you had to hire an extra teacher for a subject, you would have choice money to do that. So just like circuit breaker is your money for special education.
Right, and so so that money wouldn't be used if we had an outside placement that moved in the middle of the year?
No, it's not used for special education. That would be circuit breaker.
Okay.
But things like technology for Title I families?
Generally, the only thing that I've ever approved out of choice has been salaries. That's not saying that it couldn't be used for something else, but it's 99% of the time it's for salaries.
Additional questions or follow-ups?
That doesn't mean you couldn't take a piece of the budget, use it for your technology, and then take what you needed for salaries out of choice.
Okay.
Make sense?
Kind of.
Okay.
Thank you, Nancy.
Thanks, Nancy.
All right, Nancy Koch, special education update.
Good evening. So many of the hires that Nancy was talking about are special ed, so we are diligently working on filling all those positions. Last week, Kat Lyons, our attorney, gave a webinar for all school administrators and special ed staff. Just a refresher on just the whole process and timelines, and it was a great refresher, and people had great feedback, and there were lots of questions, so that was a great hour and a half spent. And we filed the 240 and 262 grant today. That's the early childhood and the IDEA grant. And we are now very busily working on all the standards that we need to submit to the state for the tier focused monitoring, which is what used to be called the coordinated program review. So right now we have standards for special education and civil rights that need to be provided to the state, and they will, it's like special ed audit, but this year there's no files, there's no file reviews, there's no school visits, nor staff interview. It's all documentation.
How many positions are you trying to fill?
IAs, there are several. And then we, speech and language pathologist, reading specialist, a occupational therapist. These are all very recent leaves. So we're trying to fill those.
The coordinated program review or the tier focus
monitoring, yep.
That's not an annual thing, right?
No, it's
occurs
not.
Every 2 or 3 years?
Yeah, so it's done, there's one, it's every 6 years, but there's a mid-cycle review, which is in the 3rd year of the 6 years cycle. But since this is our tier-focused monitoring and it's a whole new format, it's cohort A or cohort B. I do not know how they decided what district was going to be what. We are cohort B. So it's all document reviews.
Thank you.
You're welcome.
Additional questions for Nancy? Mr. Cohen?
Yeah, so due to the fact that we're missing some staff, is there a plan, I guess, to provide compensatory services?
We are working on that. That will be addressed on an individual basis.
Have we had any parental complaints? And if, I'm not inviting them, I'm just,
we are
doing the best we can.
We are in open communication with all parents at this point.
Great. All right, that's good. Thank you.
You're welcome. Yes.
How is the backlog coming along? I know you had a backlog because of the shutdown, the backlog in evaluation.
Oh, in evaluation, sorry.
Yeah, sorry.
Missed that. We're moving right along as quickly as we possibly can. I know all the program coordinated program directors, we're holding meetings. I'm helping chair meetings. We're just plowing through at this point as fast and as efficiently as we possibly can. We are trying to bring children in to be evaluated on their remote days so they do not miss in-person instruction. And so all evaluators are in contact with parents scheduling those now. And like I said earlier, we're focusing first on the initials that did not get done because those children could be denied services versus those who are 3-year reevaluations that are already receiving services.
Any additional questions for Nancy? Thank you very much.
You're very welcome. Thank you.
Turn it back over to the superintendent.
All right. Yeah, for some reason the DSC loves to come in and review Newburyport, so we're on that mid-cycle review, and I just want to credit our coordinated review came back pretty positive. So some of the mid-cycle reporting that we have to do is not as cumbersome as a full special education review. So so we're in good shape, but there is still some work to be done with that. I put together for the school committee, working with our leadership team, they kind of bulleted all of those pointed questions, that we received. And I think it goes on for 8 pages, which I was going to read to you all. But instead, what I decided to do is give you all a copy of those different areas regarding about how the hybrid is going in all the schools and at all the different grade levels. We've been in the hybrid model for 2 weeks. And as you can see the feedback, our teachers, I think, have done a great job in the sense of the preparation over the summertime, really understanding, regardless of what model we were going towards, there was going to be remote learning this year was going to be a big aspect. And they did a lot of training throughout the summer in preparation. But just like everything, I think once you're in it, with the students back and the teachers are back and we're up and running, I think we're continuing making tweaks at every grade level, as you can see, as they highlighted at every grade. But I think overall, I think we're doing pretty well. If you go into each one of those bullet points, at the kindergarten grade level and then grades 1 to 3, we're getting better and better, and the teachers are getting more comfortable with the synchronous and the asynchronous. The Knock Middle School reports out the same ideas as the in-person's going very well, and we continue to develop the remote and working with students and families. The silver lining, I think, with the hybrid is there's smaller classes. because we split the classes obviously into 2 cohorts. So I think the teachers are really, because they have the smaller classes, they're really, with the new students coming in, they're getting to know the students and their learning styles a lot quicker. And I think they're also getting to know the students, because it's half of the students in, a lot better. And so a lot of the advisory work and the personalized learning and the PBIS and the social emotional piece that Kathy Riccio talked about is underway. That's been a focus, especially as students return since March. And our adjustment counselors and counseling in every building is, working with students and families, the ones that are struggling, coming back. But I think that's been one silver lining. The remote academy is, it's also illustrated in here. We have remote academy from, grades 1 to 8. The students that are choosing full remote right now at the high school, because we're live streaming, that's one of the benefits of the live streaming. So they're live streaming into the class, and the high school teachers are getting, I think, better at incorporating both at the same time, and they're working with the ILTs and teacher leaders to develop more collaboration for the in-person, also the students at home, which has been very beneficial. And I think for some of the concerns for the students as we move into for that, the 25% or the 50%, for the students that are in the hybrid at the 25, that, and we feel by November 2nd, if, the health metrics and our health team here want to move to that 50%, if there is a student really struggling with that, who's in the hybrid model, that, their family or that student does not want to participate in 50%, what's nice about the high school model is they can go fully remote. So they're not going to miss fully remote in the sense of the live streaming in the classes with their classmates. I a few of the pages here kind of highlighted a lot of the PD, and that's going on at all the different levels. A lot of this is also some of that assessment work and assessing students as they're coming in to this school year, and you can kind of review that. And then, so the next page here, we also talk about the learning loss and how we made adjustments to access and, prior knowledge with a lot of different work at the different grade levels, that we have here, which we also highlighted. So we also talked about parents seeing grades on Aspen, grades 1 to 3. They're meeting with their parents virtually every Wednesday, which is probably another silver lining for parents, because the teachers on the Wednesday remote, part of grades 1 to 3, are meeting with parents, like a Zoom meeting, and giving updates, which I got to say hi to some of the parents as I visited the schools through that. And then the Mullen, they talk about the Aspen and the upload. It's a little bit different. Teachers continue to reach out to parents, keeping up with their work is part of that. So as you can see, we have a lot of the questions that were asked and a lot of the different answers. I didn't want to, as I said, read through everything, but I think on the 19th, as school committee member Reardon suggested, I think it might be a good time to bring the principals back, can actually talk to some of these bullet points, but also on the 19th can kind of give an overview of where we're at. That would be my recommendation for the 19th. But overall, there's part of the hybrid plan with students and families is there's a lot of communication going on, for the parents and the teachers and the students throughout. For the students who are not logging in, especially at the upper grades, that's where the adjustment counselors and our teachers are working with those families, reaching out to those families and those parents if a student is missing for a day or two. and they're just not logging on. So that's been also part of our plan and the preparation. You know, what if a student, you know, isn't logging on or isn't keeping up? Because that was part of some of the feedback we received from parents and students from the spring. But this is, I think, a nice bullet list of all the different areas of the hybrid. And then, as I suggested, on the 19th, I'll bring our principals back to follow up.
Questions for the superintendent?
Yes.
Mr. Callahan.
This is under school updates, so a couple of questions. I was just reading through the ESSER grant, the expand broadband line item that we got money for.
Yep.
How is that going? Because I don't envy that department at all.
For all of the,
there are so many, you know, connections between the school and your house.
Right.
And bizarrely, so many people text me, my kid's thing went down. Like, I can't possibly answer that question.
Right.
But it's happened in my own home.
Yep.
And, you know, I know to check and everything. So how is it going district-wide in terms of our bandwidth and getting out and having, you know, teachers lose their connection or whatever?
well, I think the benefit for us, so we have our tech staff, and in here it does talk about our tech staff at each building. So when there is a student that's having trouble logging on or they dropped, Don and his team are in the buildings and then problem solving that, so that student gets on within that class within an hour. If a parent, and then we also have tech support for parents and families. That's been working pretty effectively.
So, but in general, you're saying it's going well. I mean, the morning meeting for a fifth grader is 15 minutes, and if they drop out, they don't go back. They just miss the meeting.
Right. I think I haven't seen many. I think if it was like a major problem, we'd be hearing about it. But I think the increase in the broadband, we increased, I think we had like 2 gigabytes, and the max you could get, I think, was 10. And I think we chose to go up to 7. So it's more than enough, from my understanding, from Don Skane.
We mentioned this in the, what's our group called? Joint Ed, what's the new name? It's called Joint Ed. I don't know if you were here yet. So Counselor Khan had asked, the kids who are sent home for 14 days because they have a sibling that's positive or they're positive or however that works, in the lower schools, if they're remote Monday, Tuesday, and then Thursday, Fridays, they're in the building with basically the same class day as the Monday, Tuesday had been, how's that working for those kids? Because really they'd have Monday, Tuesday, and Thursday, Friday would be the exact same lesson.
Right. So
how does that work?
So for our students that have to go quarantine for the 2 weeks, so we have, part of the plan is that they'll have the remote, which they're with their cohort.
Yep.
And then when those students are in, that's where we have like a paraprofessional support staff to work with those students
like
coming
an individual thing for that.
Correct.
Okay.
Correct.
Last question, class dues for high school kids. I'm going to presume we're not doing anything that the class dues go to pay for.
But those add up over.
Right.
I know.
So what, I didn't hear, what was the
class
question?
dues for high school kids?
Yeah.
So this year's seniors, for example, good chance they're not going to do a whole lot of what they've been paying for 4 years. So is the district going to prorate that or discount or give refunds in some way to those families? Because if it adds up over 4 years, I don't know what the total is.
Right.
And then all of a sudden they say, sorry, we can't do any of this.
Right.
Then what?
Well, you would I'll have to look into that. I don't want to. I would suggest that, I just put it down here, class dues. I mean, we're hoping that, best case scenario, the senior class will be able to do more. But I think that's something we'll look at for, like, we're hoping, right now we still have everything scheduled, like senior prom and all of those things. The yearbook, which goes to the class dues, any of the senior activities, all of that. So, but I think that's down the road if if we have to prorate it or they're not going to be participating in those type of events.
Okay. Steve, can we put that in the next finance subcommittee?
Sure.
Thank you.
Mr. Reardon?
I was gonna say that that money also like goes with that class after they graduate too, so that can goes towards reunions and things like that.
Right, yeah, usually it's responsibility of the president to use those leftover funds to have the 5-year first reunion.
Additional questions for the superintendent?
I have a
Ms. Reardon?
question. If a teacher needs to teach remote because they're in quarantine, what does it look like within the classroom when the students are there in person? Is it projected?
Yeah, so the teacher is going to teach, and then we'll have either an IA or a substitute facilitate the lesson, all the teachers at home.
Okay. Is it projected on a screen?
Yes.
Or how? Okay.
Yeah. Yeah. There's a lot
of moving parts.
There's a lot of moving parts,
yeah.
but yes. So especially now, as we've had a couple of the cases, that's been what we've been doing is the teacher that's being quarantined that is healthy is live streaming and working with the substitute on the students that are in person.
Mr. Reardon?
Has the students in the high school who decided to go remote, are they is that something that they had to let the administration know? I mean, so this is the first week.
Yes, so so the difference with the remote academy is totally separate because of, trying to balance the hybrid and the remote. Because we're live streaming at the high school, the students had the option of not coming in. So they could just live stream with their teacher, follow their schedule.
Right, but I'm just saying, so is that something we're keeping data on, or are the kids just saying like, oh, I'm not gonna go to school, I'm just gonna
No. Well, we're keeping data on that.
Okay.
Absolutely.
You guys are using the different attendance codes.
Yeah, so we have to keep, as you know and Dave knows, we have to keep attendance for all of these different learning models. And that's why, like, if we have a student that's not logging on, regardless of what grade level, or if it's even the remote academy, that's where we're contacting the families and the students and finding out what's going on. So attendance is a big portion of that.
Additional
Like
questions?
15 different attendance codes to our grade book.
Right.
The list is like this long now.
And the other piece that's important, because I will, so our school updates, you have that bulleted list. We'll bring the principals back on the 19th to kind of give you guys more specifics, since we've been in this learning model for a few weeks.
Can I suggest 2 principals at a time?
2 at a time?
Instead of every time we bring all the principals here, we always say afterwards, maybe we should a couple at a time. So unless there's,
we could give them,
unless there's something barn burning for a specific principal.
Yeah. All right. It's
just a thought.
Yeah, I don't mind that. I would say just as long as I think high school's the most important one that night.
Right, that would be the biggest shift.
Yeah.
Absolutely. We could do Mr. Wolf and Principal Furlong on the 19th, and then we could do the elementary the following school committee. That works. And on the school update, so we have right now around 143 students that are remote. Oh.
Yeah, I had a question in there.
Oh, I'm sorry.
No, I'm sorry, I thought you were finished with the updates. I just wanted to be sure that this chart gets included in our minutes. I think this should go out with the minutes.
Yeah. I mean, I could make that, yes. I would like to take that back, though, and refine that.
That's fine.
Right.
But I just think this is really good.
Talking points and notes. Yeah, it's good information.
I think it's really good information that you provided by each of the schools with very specific topics and questions.
Right.
And I think this will be really helpful to be posted with our minutes.
And I'll take that back, I'll fine tune it, and then we'll post it.
Okay, sounds great.
And I would actually also say part of the fine tuning might be just getting rid of the initials, because a lot of people aren't going to understand what some of the initials are, some of the community.
Right.
And I wonder if this could get posted online when you're ready to do that. Sure. As part of our.
Those are all my talking points. I was going to read through them all tonight for you guys, but I can We can fine tune that as just an update of bullet points for each school and following these questions. That'd be fine. Absolutely. And just for, so as I was saying with the remote academy and home schooling, remote academy is around 100 and, I think when it's around 143 students. I don't have the number exactly in front of me, but we also had around 60 students homeschool. So that combo is about 200 students that did not want to participate in any type of in-person learning. So through homeschooling or through the remote academy. So that's a significant amount of the population on, not wanting to come back in person because of the virus. So I wanted
Ms.
to.
Spalding.
What's that?
Sean, could you
Yes.
just break that down by school? Like how many of them are high school students?
High school students is, it's less than 5.
Okay.
Because remember the high school students are live streaming right now.
Right.
But
Okay.
for our next school committee, I can get you the specific grade breakdown for that.
And we would normally be providing some support for the homeschooling parents?
Correct. Yeah.
Mr. Callahan?
Sean, I had meant to ask this before, but if a kid is never coming in, they're homeschooling or remote academy, how is the district handling if they have a positive case?
It'd be the
Technically, they're
same.
never coming in the building, but
It would be the same way. So if they have a positive case, first Frank would know, right? If we didn't know first, hopefully the parents would be calling us.
okay.
And
I'm
then
just
we
wondering if say it's an only child situation,
Yeah.
they're never going in the building, so.
But
why
the-
would the school be notified if they? It's
Yes,
almost as
this-
if they're not a student.
you would get notified because of the COVID positive, right, through the hospital. So they would have to start that contact tracing through Frank's department.
Would we release it as like we did today? There was
Yes.
one positive case. It'd be
Yes.
the same.
So although it's a positive case, and let's say the student wasn't even in school or fully remote, we would still follow the contact tracing. So if that student was on the weekend and, was whatever, playing in a softball team or went out, it was nice weather, went to the park and there was other friends of his or hers that were involved, then we would just follow that same process. Although it's outside of the school, it could have an impact on the school.
Ms. Spalding?
Are you able to share with parents what activities are leading to exposures? I know it's a confidentiality thing, but if it turns out there's a pattern, would you be able to share information like, 5 students?
Trump rallies, I guess, are.
Yeah, no. I mean, I think it all, like as Dr. Sue said, it all depends on the specific case.
Yes.
But typically, we're following that guideline. So if you're closer than 6 feet and you've been with the person 15 minutes or more and they're infectious, then that would constitute. So it could be, I was visiting with friends and maybe it wasn't even a big gathering.
Right.
But, the person could say I was on the railroad trail and I was talking to my friend for a half hour, and that would constitute as a close contact. So, and I think if there was obviously a big activity, something that we would publicize, then yeah, we would definitely do that. But I just really think it's from what as the mayor and other school committee members raised, it's the outside gatherings and not necessarily following safety protocols. I mean, if we're wearing masks, we're at the park, we're doing different things, we're walking the trail and there's a bunch of other people and we're all wearing masks, then we're in pretty good shape. But it's when we're not following any safety protocols that we run the risk,
Could we almost advertise, like, the way companies might advertise so many days meeting OSHA compliance and without, injuries in a manufacturing plant? say, hey, no, I would call it like school-borne cases of COVID this week. Because, I mean, I think there's a level of anxiety. Like if the headline of the email says, you know, middle school student, then you can explain all you want, but especially because you have to be so vague, like it's just gonna up that anxiety. But the reality is that it doesn't sound like it's coming from school, at least for the most part. You know what I'm saying? Like maybe that could help a little pride, a little, you know, if somebody who works in a manufacturing plant hurts themselves chopping wood on the weekends, the plant doesn't say one of our workers cut off a finger, because that would freak people out. Now, I know we have to report.
I don't want to interrupt you. I'm just,
no,
conversationally.
I'm just rambling now.
I don't think it, you can't give someone else a chopped off finger though. It's not communicable. So I know what you're saying.
No, but it would still create anxiety if we knew that like 6 people who worked at this plant lost a finger last year, but we can't say how or where. You would have to think the connection is the facility. That's all I'm saying. Like if we could start reporting the good news about how we're living and, you know,
we're holiday.
I think it creates a false sense of security, especially since there's so much we don't know. And just because the school hasn't had a positive case doesn't mean mother, father, sister, cousin, grandma. And I think it's too volatile right now, especially with, I appreciate what you're saying in terms of trying to, you know, calm everybody down, but but you see from the emails, we have people on both sides of this. Saying, please don't open up the high school anymore. I want fully remote. We want all the kids in. I mean, everybody's all over the place, and I don't know, you know, how many times reporting the cases, and what if we miss 6? What if a bunch come up that, you know, just we found out? I just don't think that's a good standard. I think it really does create a false sense of security amidst this horrific pandemic, and we don't know. We just don't know where this is going to end up.
I mean, I think the practice that we seem to be adopting, which is communicating with the parents the same day and saying, this is what the circumstance is, this is what we're doing about it. I think that has been very helpful. I think that's been very clear. I have to think more about what you're saying. But so far, I think the level to which we're communicating when these positive cases happen and what we're communicating about, I think has been really good. And let's hope we don't have a lot more communications to make.
I think you didn't see me, so I'm just going to start talking. Question probably more for the mayor. What if we have a kid who's going to Whittier or something like that? That's never going to come out through the district. So how does the community at large know that a kid at Whittier who is spending time playing soccer or hanging out here tested positive? Because the city doesn't send out notices, and Whittier won't send it to anybody who doesn't have a kid there. So how would we find something like that out?
Well, I think that's an interesting scenario, because that is potentially true. It is a district, so they would have to report it. The Whittier would be reporting, so we would get that information through Whittier. And then our health department, as with any case that's reported, would do contract tape. Even the student who was identified today, they're already working with the health department and Kathy Riccio on the contract tracing and isolation and quarantine. And so that would still continue, even if it was a Whittier student. It wouldn't necessarily come out to the school community in that same manner, but it certainly could, once it's released, the information from Whittier, we certainly could discuss how to manage that piece of information in the community.
Yeah, because I'm sure those kids are having normal community involvement here when they're not at that school, right? So, yeah.
But it would naturally come in through the Board of Health.
Right, the
It would be
maintenance system.
identified as a
Yeah.
Newburyport case, even if it's not a Newburyport student.
Right. It's a good question.
It's a tough one, because we don't get, the Board of Health doesn't send out emails to the, city at large. If you go look at it on the website, maybe, but yeah, I don't know.
Same thing would be true for day students at Governors, right?
Right. Or anybody who goes anywhere.
Yeah, I mean, it raises the question, how, to what degree are we communicating with IC, or are we communicating with the charter school to capture some of that information? Because again, there's, they may be going to different schools, but they may be playing on the same
Right,
soccer
so
team.
just so when we do start doing our contact tracing, if it's gonna have an impact on the IC or, the River Valley, we would contact them directly. But our messages, the messages that I send out, the principals of both schools also receive. So they're kept in the loop, but if it was gonna have a direct impact on anyone in their schools, they would be working with us to reach out to the families.
And if there was a positive case in either of those schools, they would be communicating that to us.
Correct. Yeah, or Kathy Riccio, if it was going to have an impact directly on us. Yeah, I mean, and it's, this is all new to everybody, but as we follow through the protocols, I think, all scenarios, students that are school choiced in here from other communities, we're all in that the contact tracing and the notification is really essential, because once we have that information, then we can reach out to the right people. And with us, I think by identifying the contact tracing and the families that are impacted, we're reaching out to them immediately. So we're isolating them right from the general population. And at the same time, when I have enough information, that's when we're sending out. I think it's important to notify people immediately when we have information. So, and that's the whole key, is try to isolate as soon as you can, so it doesn't spread.
Okay.
All right. I have a couple other things. I'll go quick. That's all right. You should put superintendent's report up front. So this is only 19 pages.
I have nothing to look forward to then.
It's I just want to give an update on the cultural competency and the work with Michael Eatman. As you all know, in the Friday memos, we've already had a couple administrative workshops with Mr. Eatman, supporting administrators and cultural awareness, some of the goal sessions, the power of a team, creating space to better understand diversity, equity, inclusion, racism, and support belonging. Assistant Superintendent Beck and myself, we had a great conversation with Mr. Eatman, because we kind of framed what we were doing with the leadership team, but he really wants a roadmap for the district on things that we would really like to accomplish. I've kept him in the loop on a lot of the issues that have been going on in the district and also within the community. And he really thinks it's important to having the school system working with the mayor and the city. So we're scheduling a conference call with Mr. Eatman, the mayor, myself, and Assistant Superintendent Beck. So we're kind of all on the same page to really, as a whole community and the school community, to really address these issues in a profound way, where we can really work on the change that we really want to see in the community. So Mr. Eatman's been great, but I really think it's important to partner with the city and the schools, so we're all moving in the right direction. So that conversation, I think we're scheduled next week, right? So I think that's going to be important. And also, I just want to say, it's been great being on the Human Rights Commission. I would say last year, they asked me to be part of the commission and the board. And that group's phenomenal. And the partnership is what's really gonna, I think, move our community in the right direction, and they've been awesome, especially during a lot of the issues we've been dealing with. They've been so supportive for the schools and everything we're trying to accomplish. So I think bringing Michael Eatman here to help facilitate is going to be helpful down the road for us. Yes.
I just wanted to add to that I think you've all heard about the Alliance on Diversity, Equity, and Inclusion that we're starting, and I was really, really pleased that we received 35 applications. So the chair of the Human Rights Committee, Amir Ibrahim, will be on it. John will be on the Alliance, and I will get you the list after we make decisions next week. There's a team of 4 people who are reviewing the applicants, and I'll let you know that committee, but clearly support that there has to be a integration of, what we're doing in the community and in the schools.
Great.
Thank you, Sean.
Thank you. And just some good news is I just have a quick little update on athletics, which we started the fall sports season, and as of Friday, cross country, we have 49 girls and 52 boys out for the team. They're 1-0 after beating North Reading, and we hired an extra assistant coach to make the cohorts for practice smaller, because it's obviously one of our most successful and largest athletic teams. Our golf team has 18 student athletes. We have a varsity and a JV, and they're off to a 2-0 start. Our field hockey has 37 student athletes and a varsity and a JV. Our girls soccer has 76 athletes. The varsity, we have a JV1, a JV2. And I think their first game was this past Saturday. The boys soccer team has 84 student athletes, a varsity, JV1, JV2. Crimson, JV2 Gold, so they have 4 teams underway. And as we all know, the football season was moved to that fall season 2, the mid-March and April. Optional conditioning and workouts are scheduled right now, following all distance and protocols. Volleyball has also been moved to fall season 2 in March and April. Same piece, optional conditioning workouts with coach following distance protocols. So far, we're off the beginning of a fall season. And as I sent out, I think in a Friday memo a few weeks ago, all the different rule changes now, in soccer, and to try to maintain the physical distancing throughout. So whole key is to try to have some sense of normalcy and bringing kids back, and I think extracurriculars are a big part of that. So yes. Oh,
Mr. Reardon.
Are we going to have a student representative this year?
I think we can. I'm not sure if because of.
I'm just asking. I'm not advocating.
No, I think that was something I was thinking
Your
about.
report just reminded me.
Yeah. No, I was thinking about that today myself.
He's so youthful.
Who, me?
Brandon said your report reminded him of a high school representative.
Yeah, thanks.
Sports minute.
Yeah, I think definitely having the student reps back, I just, as they were coming back to school today, I think it's something that being, part of the whole COVID piece is something that, we'll reach out to the high school. But absolutely, I think if they're willing and they want to be part of our meeting, I think that would be awesome.
Yeah. Does Mr. Wolf have the student government up and running?
He does.
Because I'm thinking it might be a place to consider a petition like that was sent to us, and maybe to dig a little bit deeper. The student report's always nice, but to actually find a way to get some voice into the politics of the policies might be that much more meaningful to them.
Great.
And the sports, the winter sports, like, maybe like indoor track, swimming, cheering, is that all moved to?
There's been no decision on any of that.
So traditional winter indoor sports?
Still up in the air.
We just don't know yet.
We don't know.
I think they have a tentative, like, January 1st start.
Yeah. My thought process on that was to have our athletic director come in around the November 2nd school committee. He may have information on the winter season, but the MIA and the state's kind of up in the air with that right now, too.
When did we add swimming? There's no swimming.
We co-op.
No, we co-op.
Oh, we do?
Yes.
Yeah.
Which school?
With Triton, right?
Triton.
Oh, Triton?
Yeah.
And what facility do we use?
The YWCA.
Oh, really? Okay.
It's our home pool.
Okay.
Quick story, Mr. Cole. I went to a swim meet my first year, and it was 0 degrees out, and I had a sweater on, and I saw the parents, and
tank tops.
Yeah, so I was the rookie superintendent. They let me walk into that pool and with my sweater, and within 5 minutes, I lost. I probably could have wrestled a lower weight. So after that, and then when I walked back out, the parents were laughing. They're like, "We didn't want to tell you." And I'm like, "Oh, thanks."
And hockey also?
Hockey, yeah.
Hockey's been pushed back or on hold?
Everything's on hold for the winter sports.
Did we leave that league and do our own hockey thing? Wasn't that the whole, what,
Yes.
talking about leaving the, what was that?
It was the girls.
Masco Co-op girls ice hockey.
That was the girls. We have a boys team. It's just ours though, don't we?
Correct.
Now it's ours, yeah.
Yeah.
Any additional questions for the superintendent?
That, yeah, I guess this would come up, had I been at the last finance committee and had thought about hockey for any reason. Is that gonna change the fee schedule for hockey, presuming they actually play? Because wasn't the whole thing that Masco was charging us way more than they should have been?
Right. So we have, we have, I don't have the fee structure in front of us, but since it's our own team now, the fee's gonna be reasonable.
Will we have to vote on that then? Because we voted on the schedule, on all of the fees as one piece. So will Kyle have to figure out what that's gonna be, and then we have to vote again to say okay, right?
Yeah. I have, for the next FinCom meeting, I have, our athletic director is gonna do a presentation on that. Because we followed up from last year. He was supposed to come into the FinCom, and I think we postponed it because of the COVID. So I think we could have that discussion at that time too, on the girls' ice hockey.
Okay.
Great. We can double up to item 5, which would be a discussion of the Mass Guides to Conduct, Operation, and Practices. Before we do that, if I'm reading the room right, I think we could probably push this off for another meeting.
Yes.
Can I ask a question about this? Was this something that we were thinking about maybe doing a retreat for?
Yeah. But I also think that it's gonna be helpful for us to have a conversation about it.
Because we usually sign these at our January retreat, right?
Actually, we sign them either at the January retreat or we sign them at our first meeting in January. We used to do that. So, but I'm fine about holding that off. We would then move to subcommittee reports. Mr. Reardon, Joint Ed is first.
Joint Ed met today. We had a pretty spirited conversation. One of the things I did bring up that I thought was important, and Mr. Menon said this is going to be on our next meeting, is talking about the next strategic plan. You know, what's that process going to look like? How's the community going to be engaged? Timelines, things like that. You know, how are we going to make this a real transparent process with minutes and posted meetings and things like that. So I guess
we're going to have that added to the next agenda, next meeting.
which is good. And, you know, again, a lot of it was just kind of jumping into the metrics document that we talked about tonight. So that's essentially what the conversation went around.
That was one of the goals we set up this year, we set up a bunch of like ideas around restarting starting the next strategic plan.
Yeah, it'll be on the agenda for the next meeting to have a discussion about how we want to do that. You know, sort of the review of the plan and then proposing how we're going to engage the community in the conversation. Finance?
They haven't met since last reported.
Policy has an upcoming meeting?
Next Tuesday. All right, we were gonna do Monday, but that's Columbus Day. So we do next Tuesday.
Was that okay? Sean, did you?
Was it the 13th or the 14th?
You commented on an email and said Wednesday.
Was it
I think the 14th.
I think Wednesday is the 14th.
Wednesday is the 14th.
So it's gonna be the 13th, the Tuesday. Because for some reason somebody couldn't do Wednesday.
I just said I prefer Tuesday. If you want to do Wednesday,
I couldn't do Wednesday.
We have something
Right.
scheduled
you
that
can do
Wednesday night
Wednesday.
now
Sorry.
with Michael Eatman. That
Oh, yeah.
Wednesday, the 14th. That's
All right, so I'll
And
adjust my
Tuesday.
calendar to do the Tuesday.
Okay.
I didn't know there was 2 other school committee members that couldn't do that. That's fine.
I'll double check.
It's all right. I'll move mine to the Tuesday, the 13th.
Superintendent's evaluation, Mayor Holliday and I have not met, but I've started to do a bunch of research on what other districts are doing and what the state guidelines are. So we will try to set up a meeting in the next couple of weeks. Do we have a motion to adjourn?
So moved.
Second.
All those in favor?
Aye.
We are adjourned.